Hello, everyone. I'm Lana Kerr. I'm the founder and CEO of Lumis Skincare. And it's really an honor to be here with all of you today, and even more so to have this esteemed panel that, operator, you can bring us, that, that really needs
Late
no
for lunch.
introduction. We have Dr. Zeidler, Dr. Hoyos, Dr. Franco, and before I turn the meeting over to them for them to show you how the CO2 lift is working, I just wanted to give you a little bit of a founder story. Just to give you, my first business, I was 14 years old. I graduated high school at 15. My educational background is in accounting. I was a CPA, started my journey at KPMG, and then, did a numerous other ventures. I think what has been similar about the ventures that I've done is that they're all a new start to something new and exciting. And CO2 Lift is no exception to that. CO2 Lift, founded the company in 2015 is when I discovered CO2 carboxy, which is what we called it, CO2 Lift carboxy. Carboxy therapy is not new by any means, just gel delivery system is what is new. Then we launched it in 2016 at a dermatology meeting, a premier dermatology meeting, GDerm, and then at Scale, which was a multi-specialty meeting with Dr. Michael Gold, and it was a hit. We had 300 accounts that opened up. Of course, I was very excited about that. Then at that time, doctors would only apply it in the office. So it was in 2017 that they started giving it to their patients to do at home. And then in 2018, we discovered, or I thought of a new way to apply it was with CO2 Lift V. At that time, I was 47, going to be 48 in 2018. And I discovered that aging affects not only your face, your neck, and your hands, but it affects your intimate skin, vulvovaginal skin. And I knew about how CO2 lift increases blood supply, how it regenerates the skin very quickly, which you'll hear about. And so we said in our advisory board, I said, what do you think about using it in the vulvovaginal region? And that was a success. And then, of course, we did numerous clinical studies because I think that's important to all of you to understand that there's science behind the magic that you're going to hear about today. So CO2 lift, that's what it looks like. And all of you will experience this today. We're going to be putting it on some hands, is the first carboxy gel on the market. And it can be used in the office. It can be used with various different providers, surgical, aesthetic providers, estheticians can use it. But it really is a powerful anti-aging solution. It can be applied to all parts of the body. That's it there. And again, what is carboxy therapy? It's a therapeutic use of CO2 gas to regenerate the tissue. Again, it has a long history. It actually started back in the 1100s with the samurai warriors, and then most people commonly know about it with injections. And then again, we have the first gel. But as you can see from the picture, that's pretty much how it works. It's not a device, it's a gel that once it's applied to the skin, it penetrates to the microcirculatory level and it expands the capillaries, bringing along with it not only blood supply, but all the rich nutrition that's in the blood. The science behind it, I'm sure all of you did this in medical school, the Bohr Effect. When you change the level of concentration of CO2 in the blood, there's the ability for the hemoglobin to transport the oxygen diminishes and it unloads in that area. And so that's why you're getting that high supply of oxygen. That's what it looks like in a video capillaroscopy machine. One of our studies, we looked at what it's doing under the skin, and you can see microcirculation improved 28%. These are some of the effects of when you put the CO2 on the skin. It's improving vasodilation, flow motion, neoangiogenesis. That's what is happening with the skin, underneath the skin. And as I mentioned, we've invested in several clinical studies. I think what's most impressive to me is the hydration level. I always like to say you don't get old, you dry up. And there's nothing on the market that improves hydration like this, 117% after one application. And then, of course, the skin quality. You're looking at double-digit improvements in skin quality. What's impressive? The elasticity. 26% increase in elasticity after only 6 applications. What does that? Nothing. 100% re-epithelialization of wounds. So it's great for wound healing. And again, it's reducing the downtime. And those clinicals have been published. We have looked at other so-called carboxys on the market, and we've actually done studies on them, and none of them are touching microcirculation. So you can be sure that the CO2 lift is the only carboxy gel, true carboxy gel. I'm just going to quickly run through some pictures for you to see it before I turn this over. This is one of the things that made us know that we would be so beneficial for surgeons because of how it really accelerates healing of the skin. We did a diabetic wound healing study, and all of there were 8 months of non-healing wounds. They closed within a month, 3 applications a week. In a month, they closed. And again, this I think was the biggest challenge for us because it has so many different indications. It can be worked for, as I mentioned before, surgeons, for aesthetic providers, for the skin. Where do we focus? It's helping with complications. It's helping with eczema, rosacea. Where do we focus? So that was a big challenge for us. Then the CO2Lift V, which I think is just so a needed thing in this market for vulva-vaginal care. And it's not only helping with women, by the way, it's helping with men. We have Dr. Roy. We had a male study, and we have a urologist who's seeing how it's working with erectile dysfunction. It improves the SHIM score 5 to 12 points after only 5 applications. But that is something that with surgery, when you do any kind of labiaplasties, vaginoplasties, not only helping with the healing, but women are doing this to improve the function, to be able to have better orgasms, have better sex. That's what this is doing. And they can do it in the privacy of their home. So these are some pictures I'm going to quickly show you. This is just as a standalone. I think what's impressive, as you can see, this is 3 CO2 lifts once a week. That's it. Look at the quality of her skin. It can be applied over the eyes, underneath the eyelids. Again, great improvement. Psoriasis immediately post. That's 6 days later after 3 applications. Isn't that impressive? Again, here that's with rosacea. And it's interesting because in rosacea, we're improving vasodilation. Why is it helping with rosacea? We're currently doing a study with the Mayo Clinic, and they're looking at skin microbiome to see why is it actually so effective. Again, there's just some more pictures for you to see on all different skin types, all different color skin. This is great after injectables. People leave after toxins or fillers, and they want to, well, fillers see right away, but toxins, they want to see some improvement right away. Here's the solution for that. And again, this is after skin pen. Look at her skin immediately post. I'm going to go through the pictures here. One of the things that I think this shows, as well as this one here, is it can be used, a CO2 lift can be used right on top of numbing cream. This instance, they were going to do the Morpheus 8, and they put it on top of the numbing cream. Look at her skin before she actually did the procedure. Not only that, it's going to make the procedure more comfortable. And lastly, for these slides, it can work on breast tissue. This is radiated breast tissue. So we have a wide range of indications. We're going to hear from these top surgeons here today, your peers, and see how they're using it. And I'm going to turn over the meeting to Casey. Casey, thank you.
Okay. Well, I like being MC. That's where I shine. They do all the work and I can just guide the conversation. So we're going to make sure to have a nice time for Q&A at the end to really get into some of the nuance on how we use this in our practices across the board. So we'll get right into it. How many of you have tried the mask on your face? So for ultimate glow up, yes, my dermatologist partner in crime is here, and we are big fans of it as a travel recovery. So always pack in your bag for every meeting and glow up. Um, I'm going to talk a little bit about the use in facial and breast surgery. So as a plastic surgeon, I do facelift. I do a lot of fat transfer to the face. I do a lot of face fat transfer as well to the breast, and use it here as a peri-procedure treatment. So capitalizing on that Bohr effect, fresh grafts survive by imbibition. So anything that creates some vasodilation and delivers oxygen to the tissue, could enhance the take overall in addition to improving skin. So this is a great way to introduce this to patients at a surgical interchange, and they love it so much. When we were doing split face studies, they're like, can I please just stand on the other side of the face? And then they're hooked, and they continue to use it as a maintenance product. But this patient, she was one of the first ones that I did a full 3-day course of CO2 lift after her procedure. She'd had a mini facelift, and then I did fat transfer to her cheeks, her lips, and her chin. And this is probably the most phenomenal take I've ever had for lips with fat transfer. And even a year out, she has a stable result. So it's beautiful and significant. Um, I do a lot of micro fat for neck contouring, and this is a great place also where we apply the mask post surgically to improve skin quality, and it's something that patients then continue to use once a week. And fat grafting around the eyes, where there's lots and lots of nuance, little tiny bits of fat that you want to be very, very precise. Um, and use it here. And we talked a little bit about this yesterday, nano fat for skin quality. The combination of nano fat and post-procedure treatment with this mask is phenomenal. Um, big fans of this treatment in general. But what you can see here, let me move on to the next one, is applying this mask right in surgery. So I've just finished with bleph and fat transfer to the face. And before we actually wake the patient up from surgery, apply the mask, then they're extubated, rolled to recovery. It sits for 45 minutes. By the time they're coming to and waking up, we can get the face fully dressed and they go home and do the mask post-op day 1, 2, and 3. And then again, because of the hydration, because of the luminosity, when they're very dedicated as a surgical patient taking care of themselves, it's something that they definitely want to continue. And after doing this in the face for, oh gosh, it's been like almost 2 years now, only because I personally fall in love with the mask. So why shouldn't my patients benefit? I also do it in the breast. So I do tons and tons of fat transfer in the breast. And in these patients, we're maintaining volume. We want to do all the things, high quality processing of the fat. We also do this in our perioperative care. So patients will buy a 4-pack. We apply one at the end of surgery. It's really messy to roll a patient off the table with this on, on the breast. So we just roll them into recovery and it's applied there. We just put a blanket over to cover, they sit, and then same thing within 45 minutes as they're ready to be discharged, it can be removed. And this is something that can provide really high quality results in achieving symmetry and fat transfer. So with this, like Dr. Hossauer, my partner in crime as a dermatologist, we put together all of these perioperative packages that it's a line item at a consultation. It's, a few $1,000 add-on, but it's a box that people get with all the things, all the pre and post care. There's topicals. CO2 Lift has actually become a foundation of that, along with other topicals, you know, facial treatments, Vaser shape, heated ultrasound for body contouring. But having a patient use a product at the time of a surgical procedure is a very powerful way to have them invested in future care. And that's where this really fits in well. So with that, I'm going to turn things over to getting a little more detail into what Dr. Hoyos does.
I think they were afraid that I was gonna take over like 2 hours because they only allow me to have 10 slides. What can you say in 10 slides?
10 times 10.
Okay, one of the things that is interesting for us Latin American surgeons is that we always, if you have a practice in body contouring, specifically doing secondary surgeries, you always have in your med spa, you have a carboxy therapy machine. Have you seen one? Any of you? No? Okay. Is a device that has like a like an oxygen tank and it has a bunch of like tubes and ends up in a tube that actually you have to put a literally needle and you stick the needle inside the skin of the patient and you literally pump it up, so it's very painful, very, very exquisitely painful. So most of the patients actually quit this kind of treatments, especially when they have secondary. It works amazingly for secondary patients for fibrotic tissue when it's like just starting the fibrotic tissue to form. When you put carboxy therapy, it just goes away. So for us, it's very interesting. And the other use that we have is mainly for flaps that actually are in risk. So we usually use it, and again, we have to pinch the patients, and we have a very nice vasodilation. You have to use it not in the area that is the area of necrosis, but around it. So actually, the vasodilation actually gets more vascularization over the area. So when I saw this, and I saw the science that is behind it, specifically the neovascularization and the vasodilation that it can provoke doing transdermally, so meaning non-invasive, non-possibilities of having more infections, because one of the keys also when you have flapping risk is when you start pinching and pinching around, you can even have the flap with necrosis and also infected. So it's something that you don't want. One of the things that I saw here, and I was one of the sell points for me, was the healing properties that it has. They actually a very interesting article that was very simple. They took biopsies behind the ear. They put for a week the product, and they took another biopsy, and they actually analyzed the new vascularization, new capillaries, and the density and diameter of the capillaries. And of course, it went very well. So one of the keys that we started to use it was in these kind of patients that have these kind of problems when you finish the surgery, specifically secondary patients, patients that also have like a lot of bruising. We started to see, we started to use it for the flap. So actually, we started to use one side yes, one side no. And what we clinically started to see is that the side that we started using it earlier actually had better recovery sooner. So they have less bruising, and the bruising actually went away quickly. So it was very interesting. But let me tell one story. We were using it. One day I finished the surgery and I start to see this. And when you see this, your balls actually go like this high, especially because it was, a secondary surgery, but it's just a regular liposuction. And if you see on the left side, all completely like blue, you know, and on the other side, a little bit bluish. So I said, okay, bring me the stuff, that stuff. We mix it, put it, and the idea also is that when we start to mix it, we also have to put a cover. So usually, what we use is also like a piece of plastic or anything that actually covers it and actually concentrates a little bit more. So you wait for an hour. Usually the average time that it works is around an hour. So you peel it off, literally, and see what happens. So it looks even better than the other side. So that was, for me, that was a no-brainer from then on. And we started to use it. This is the same patient, after 2 months. So actually got fully recovered, didn't have any points on necrosis. And we started using it in every single patient. We started to use it, especially in patients with flaps, all over the flap, especially mini tummy tucks, full tummy tucks. One of the things about the mini tummy tuck is that the necrosis doesn't happen at the edge, happens in the center, in the center, around the umbilicus. Why? Because you actually the vascularize all the area that is the perforance around the umbilicus. So there is nothing you can do when something like that happens. So when we started to use that, especially in these kind of minutes, this patient also had this kind of bluish area right there. Secondary patient, very hard, very difficult flap to raise. We started using it, and it works for us very well. So take a look at this one. This kind of bluish area that that is gonna have necrosing. We started to using the idea that we start a protocol in flaps, regular flaps, every 8 hours. They actually recommended just once a day, but we can push it to every 4 hours in the case we need it. So this was the first patient that we use it every 4 hours. And take a look at this. We entirely save the spot. And this is the kind of spots that are the tricky ones. Because sometimes when you have a distal patient, distal flap and a little bit necrotic, you can save it, but in the central part here in the flanks is a complete disaster. Also, in the nipple areola complexes, when they start to be a little bit more bluish, or in this one, for instance, in the right side, and it works really nice. So at the end of the day, we started the protocol because of the fibrotic tissue. So we started to use it in one side of the arm versus the other, and we actually had a statistically significant improving in the fibrosis, especially after the surgery. Usually, the early fibrosis in these patients start around 1 week, and it expands up to 21 days. So from 7 to 21, you have to take more care of the patients. These kind of secondary patients, due to very superficial lipo, because that's when they actually form the fibrotic tissue. So you can see here, we did one arm, yes, one arm, no, in statistically significant also the reduction of the fibrosis. So later we started with the thing that actually happened accidentally, and it was this, say, okay, what happened with the bruise? Because the bruising of these patients in the side that we use it actually went away quicker. So we actually started by doing with a software, analyzes the colors of the picture, and with the pixels, actually analyzing the pixels, how many pixels are in the kind of the hematoma or the ecchymosis, and you can analyze also how much of this area varies in a more objective way. So at the end of the day, what we started doing is, especially in the legs and in the arms, we start to do this. So we started measuring with the software the transit between the day one and specifically up to day 12. That is most of the reason I actually go. So what we started to see is that the areas that had the product had easier and more prompt recovery. The chemosis actually went away quicker than the other side. Even in patients, for instance, because we actually chose it by chance, is just flip a coin, right or left. So in some patients was the more bruised side, in some other patients was the more like literally white side. But we can see here with the pixel software. And for instance, here on the right side, well, to the left side, um, this was the one that actually was taken. And I actually chose this one because it was interesting because was the one that was more bruised than the other one. So we started to see the evolution of this. And by day 12, actually was better than the other side. Same in the arms. So actually you can see here the side that actually used the CO2 you can see that the chemosis actually is gone more quickly. In average, 5 days rather than 12 days from the other ones. So in essence, is working nowadays. As the doctor does. We usually use it for most of our patients everywhere. They actually use it also for cosmetic reasons, but mainly for the recovery has been a game changer for us. There is not like a literal like toxic dose of this because the action is only 50 minutes. As I mentioned, for instance, in these patients, just for chemosis, we just do it once a day. For flaps, we do it every 8 hours. When we have a patient that has a flap that is in risk, every 4 hours for at least 5 days. Thank you very much.
Mhm. Awesome. Um, Really, really great data, and pictures are worth 1,000 words. So awesome. So everyone knows Johnny, and I think he's really going to take it home to look at the full scope. Austin plastic surgeon is a force, and talking to us about how to really integrate this into the practice. And then after that, we'll get into some Q&A. Good.
Definitely two hard acts to follow. So, can you talk a little bit about how we've integrated into our practice? I think they've already shown some pretty phenomenal pictures, but I'll tell you, kind of even my mindset because the first time I heard this, they actually bragged about Alfredo about this. I think you introduced me to get this going into our practice, but probably like many of you, it's always skeptic. Like this sounds too good to be true, and honestly, we brought it into our office, and our nurses, kept telling me this is phenomenal. You need to try it, and like most of you guys, I'm like one more thing, one more add on, especially right now, and it just becomes a little hesitant. And so, but kind of like Alfredo, I tried it on one patient, and the difference in bruising from one side to the other after that day, I was like, I am sold. This has been phenomenal. And I'll show you a few of the things of how we've integrated in our practice from the utilization to the implementation, skin practice, and practice enhancement. It's any of you guys that know me that business development and practice enhancement has been a huge passion of mine just because I feel like as us as plastic surgeons, and I mean, it's our chance and we need to hold on to our turf. We need to be able to be the leaders here. And I feel like we have so many opportunities to do that and be the thought leaders. We're in such a pivotal time with technology, wellness, and all the new things out there. In our practice, we're kind of split into three pillars. We have our wellness, our surgery, our med spa. And so I'll just touch base a little bit about how we integrated into each one of these pillars for us and how it's been helpful, especially in crowded cities. Anyone who lives in Dallas, Houston, Beverly Hills, these cities, it's how do you make yourself stand out in this crowded world of a lot of good providers? you know, Med spa utilization, and we've tried to do some unique stuff, and bruising has been probably the biggest reason we've done this. We've incorporated with a lot of our cellulite, our ovulate treatment stuff, because a lot of the pushback in the past was like, oh, cellulite treatment, some of these lipo stuff is only a winter sport, and so not true, because who doesn't want to look phenomenal in a bikini? When are you thinking about it? When you're in the bikini, when you're showing this off, most people don't want it because of the bruising downtime. But if you can cut that into a couple days and do this on a Monday and be poolside perfect perfect by Saturday, I mean, that is a huge win. And now you've made your treatment year round. You can combine this with energy devices. And so it's just another value add and another way to, set your practice apart because, right, most people don't know when they're either looking at before and after pictures on Instagram or different things. And you guys know we're all competitive. I look at Dan's pictures, I look at Jerry's pictures, and all of us are competitive, but so are patients, right? So all they know that, oh, Alfredo's picture looks better than Johnny's picture or whatever. And so they may not know all the different things you did. So if they're like, oh, wow, this person had no bruising at 3 days, they automatically associate that with you being a better surgeon provider of things. So that's one of the things that really made a big difference for us in terms of opening up treatments. We do stuff a little bit differently, and I'll get it in just from a timing of our office. But we've been able to incorporate it with everything. So with any of our resurfacing, skin tightening for us, skin tightening has been a huge thing just because of the weight loss and wellness things in our practice. And so we've also been exploring whether we can combine. And so hopefully next year we'll get invited back in the study that we're starting in terms of implementing carboxy gel with numbing cream. So if you think about it, if you can open this up and if whether you can actually make that more effective to make a lot of these energy devices a little bit more efficient, a little bit faster, because time in the office of them numbing is one thing. Some of these energy devices you kind of want to crank them up a little bit, get the best result possible. So if you can make this super comfortable, so TBD, but something we're working on and something I'm super excited about. Post treatment, I think anything that makes the experience better. I'm a big fan of creating an experience, something that's very unique for them. I think is super helpful, and so something that they actually have tangible to take home, something that's different than all what their friends are doing. Application process, we do it a little bit different in terms of this. So when we see our patients and we do this with our energy devices, any body stuff, any butt stuff, we'll actually put the gel on. We just saran wrap them. We put their garment on, put their compression garment, whether it's the Ovally stuff, whether it's lipo, send them home with that. And then when we come back the next day, take it off, put another application. And then that way we don't have to keep them. We can just do it right in the operating room, send them home. They just leave it on overnight and then come back. Because you put the saran wrap over the top, it's super easy, super fast, and really kind of clean and makes it easy in terms of things for us. I've actually turned this into what we call like our rescue kit, like the rest of the panelists, and it's sort of evolved. At the beginning, used it just sporadically, and then at some point, it's like, well, if I'm only using this when I'm super worried, why don't I use this all the time to prevent my issue stuff? And so, kind of rescue kit for everything. I don't do much skincare, which you can probably see, but then I'll put on the gels, right before my ASAP's presentations to rescue my skin. I've done it for some of our breast stuff. We've all had breast reductions or nipple stuff that feel either a little bit tight or you're worried about some of those T spots. That's been absolutely phenomenal. And then at this point, we've just built it into our price. Anybody that gets energy devices to their tummy, anybody that gets any type of HD lipo, they don't get a choice. It's just built in. It's part of the process. Hey, look, we don't want you to have a problem. And a lot of that came from not necessarily like skin necrosis issues, but how many of you have pictures and you're like, damn, this person looks so good. And you're just waiting for that bruising to go. So you can have this phenomenal before and after. And like every time you come in, you're like peeking in the door, asking your MA, is all the bruising gone? And so just waiting and waiting. And so to be able to get that done, because, most of the time at 3 months, they're only coming back if they're unhappy, and no matter what you want to get them back. But if they look phenomenal right away, and again, for summer, opening up from a marketing standpoint. And so we've started to expand this into other procedures, but definitely become our rescue kit, if you will, in our practice. For surgery, I won't beat this up too much. I probably did a phenomenal job talking about this, but can't echo enough. I mean, just let alone decreasing the bruising has been absolutely phenomenal in terms of recovery, making our practice look different than a lot of others, because people just have the mindset like, wow, I didn't have bruising. I was moving faster than my friends who had lipo or something down the street. They almost feel like it's your unique value proposition, right? That like, oh, you were more gentle, you were more caring, you were more skilled because I get lost bruising. I mean, you guys all know bruising doesn't necessarily correlate with that, but it's the picture in mind that they have in terms of that. I think also innovation in this day and age of social media, different stuff. I think people really are looking for somebody that's innovative, somebody that's doing something new, something that's cool, and obviously something that you believe in. You can tell all three of us, obviously have a lot of conviction about this. We wouldn't be spending our lunch here if we didn't believe in this, and obviously a lot of people are interested because you guys spend your time to come here and want to do something that's better for your patients. So definitely been an improved experience for them. And so just been kind of our practice stuff. And I guess I didn't finish that slide, but A couple other last things in terms of stuff for our practice, enhancement stuff. I really believe in this concept of league magnets, and so in this day and age with the economy and so forth, I think if you can find something that's a low barrier to entry, something that solves a problem for them, something that makes a difference, that isn't a huge value add in terms of cost, you build their trust, and then you have a patient for life that you can move along this. I also think cross conversion. So if you think about it, like for our practice, a lot of times we'll do these where I put it on them at surgery, but then we'll see them the next day. The team does it. The esthetician comes in and helps put it on the next day. So it's already an introduction, because we always talk about, oh, we'll do a free, consultation or something. People's time's valuable. Like, okay, but what am I going to get out of this? What am I going to do it? When you actually do a cross conversion that is meaningful, purposeful, like what's the purpose? There's a value, you're spending time. They're seeing the benefit coming from that person. Now it's such an easy move to that next spot. So I think that's super important in terms of things. So that's kind of all I got. So appreciate your guys' time. Thank you.
Yeah, so this is a picture of Alfredo when we we met to introduce CO2 Lift last year. It was just over a year ago. So who wants to try it, right? You guys want to try it if you haven't already? So I think we'll get that opportunity. But we have a lot of time for question and answer. We want this to be really interactive. We're here. So I don't know if anyone. Okay, we've got a hand up right in the back.
Um, I was wondering if if it has been looked at to compare to nitroglycerin, number one, and number two, on irradiated tissue. Obviously, in plastic surgeons, it's a huge issue and area. They looked at whether that's vascularity has changed at all.
Well, I don't have any experience in radiated tissue. We actually used it in one patient that actually had reconstruction, breast reconstruction after radiation. So it works, but I cannot say that it is actually a cost effect. I can tell you it works much better than the patches of nitroglycerin or anything like that. Because usually when you use it in an area, a patch, you use it in an area that is, in risk. In the area that you put it, you have a necrotic area. So it's a little bit too harsh, for the skin and specifically for the dermis, With this one, we didn't have any problems, On the other side, I also have a hyperbaric chamber, so we decided actually doing some patients with the hyperbaric versus this. And, I cannot say that it's the same thing, but the effect is very similar. The idea is that we actually induce a vasodilation, and you can use it over the tissue that is necrotic, and you can use it over the tissue that is surrounding tissue for generate the vasodilation. So I think it's very safe, very effective. Actually, that's also like a little bit of this emulsive humectation effect.
So the other thing I would ask is, the ability for near infrared laser detection of mixed saturated venous and oxygen saturation can be independently measured to get a good estimate of that tissue. So it'd be interesting to see, is it really affecting venous outflow or is it affecting oxygen inflow? Because that might tell you where you might expect to see more improvement and which effect
That's
might.
interesting. That's
Yeah,
a very
so
good idea.
what I'll say is we are looking into some of those things. Like as a resident, I did a study with using T-stat. I don't know if you're familiar with it as in being able to measure oxygen in the skin. So we are looking into all of those ways to get objective metrics that we all want to see as published data.
And I think playing with the different like applications, the different spots, I think, the cool thing here is even when we're putting this together, we were brainstorming and we could have made this a 3-hour talk of all the different options and stuff. So, but I think trying to really hone on where it makes it, and then even some of the applications, 8 hours versus 24 versus 4. And so I think we're just scratching the surface, I feel like.
One
Absolutely.
important
On
mechanism.
radiated tissue, we have been using it on radiated tissue. In fact, that last picture slide I showed you was on it. That was 2 applications. I mean, that was done on the Friday, and by the Monday, completely resolved. So we have been using it. Sorry.
The mechanisms are really different. So like the nitro paste, you're increasing vasodilation, and you put it not on the area that you want it to work on, but somewhere else on the patient's body if you want it to be absorbed and effective. So that's important. And think in a patient who has a venous compromise to the nipple, for instance, nitrate paste may not be the right choice because you're increasing the venous flow instead of improving the oxygenation to the tissue. Carboxy therapy offloads oxygen at the site and it's absorbed through the skin and with this type of formulation. It's a very different mechanism. So these are different types of patients and different types of applications. I think it's important to you think about different practice. Like if you have a facelift and you have venous compromise in the skin, the last thing you want to do is increase the vasodilation. You want to increase the lineage of the tissue and allow the body to kind of pick up and change the venous outflow. Carboxy therapy may actually improve venous outflow specifically by the effect of the oxygen in the distal arterial and venule, which that's a very different mechanism.
Yeah, that's a very good point,
There's
Dan.
actually been a study that shows that a single application of nitro paste on mastectomy flaps does decrease mastectomy flap necrosis in a controlled way. So I mean,
Yeah.
I'm not arguing the point. I'm just saying these are questions that we should have that would really, really be nice to understand.
All really great questions. And we have lots of technologies between, spy angiography to look at vascularity, oxygen saturation monitoring transdermally. So good points. Other questions?
Jared. In terms of protocols, if you're doing other things, let's say like with woman repair, if you're doing this, do you guys have like certain protocols where you're putting one on and the other, and you do it after a certain amount of time?
Yeah, I mean, in some ways, it's like all the things come together for great results. Just like Johnny's saying, Alfredo's saying, giving the patient something that has a better value proposition than your competitor down the street. So, we do skin aid, systemic therapy. We do topical, like twice daily therapy. Elastin products are great. Different companies have different things. And then we do a very focused treatment. So even we've started incorporating more like a pre-treatment, like morning of surgery to a mask before the facelift. Facelift's done, immediate post-op day 1, 2, and 3. And I had a facelift recently that one side was perfect, one side was just a little congested looking. I did an extra 3 days of the mask focused right in this area. And of course, while she's doing that, it's like you put it everywhere, put on your neck, put on your hands. Why not? And then continuing that post care. And what's really nice is the way we've designed our pre and post care packages is that everything is very thoughtful about being a maintenance product. And so this mask is one of those because we're saying, okay, take it for your next vacation. Like you're going to Hawaii, enjoy that body. Like take this as soon as you land, do the mask, you'll be all glowed up. And so it builds in so much trust when a surgical procedure goes well to then take the recommendation to use these products afterwards.
Did you have any case control study or just experience for this?
Well, what
You
we
want-
are doing
yeah,
right now,
'cause- yeah.
the thing is, case control is a little bit difficult because, you cannot underdo, for instance, a flapping wrist cannot do something. What we are doing is different type of protocols. But what we're doing, these days, closest that we can get to case control is doing contralateral study. So we do one side with one side with the control. So in some sense, the same patient is a control group as well.
Yeah.
One of the complications after liposuction is the delayed hyperpigmentation. Do you have a study about it or experience about it?
Well, actually,
Exactly. That's one of the key points here, because one of the keys of preventing or trying to diminish the chemosis very quickly is because we want that these deposits of hemosiderin, that is literally what causes later the staining of the skin, don't happen. So that's why we started using, especially in the inner thighs, posterior part of the arms, that are the areas that actually create these kind of hyperpigmentations in the long run. And that's what we're trying to evaluate in the long run as well. So actually, the part of the chemosis is directed to that, directed to prevent staining and preventing hyperchromias in the skin.
That's what we're trying to collect this because, we had a pretty stiff protocol, my partner and I. And so comparing the people, that we did before and now after, and just, comparing blindly the photos from those at the same time points because we have set time points that we do. Because that was the main reason I started is the staining stuff here when they look great. And it's just so frustrating when they look so great. And all you see and all we see is like those spots. And you're like, oh, drives you crazy.
Yeah, I'll say is I did a split face study on facelift patients, and we were looking to, it's hard to measure complications when you're such a great surgeon and you never get any, right? I'm just kidding. Again, all the ones all of you have and more. But in something like a facelift or see like very visible changes, you don't see as much as you do in the body, but um, it was hard to capture in photos like skin luminosity, right? And hydration. Like we know, like having a dermatologist in the practice, we know it's so hard to measure the radiance and luminosity in the skin, even though patients experience it. But we did when we did split face the patients. I remember one patient in particular. She's like, I feel like the side with the mask is like sucking all the fluid hydration from the other side to this one. So the suppleness and like the humectant effect, the hydration and the vascularity is there. And if you try the mask on your face, you'll see the radiance immediately. Good questions. Other questions?
I'll tell you, we started just recently pre-op kit stuff like you have. It has made such a difference because in this day and age, are going to do something, and if we can dictate kind of that story and help it, it decreases the calls from. I mean, people find stuff on the internet, other things that are not only not helping them but are super detrimental, and so it's been super helpful to kind of outline that whole journey for them for sure.
Yeah, I think it builds a lot of trust to maintain that, having these parts of the practice that have recurring revenue, the med spa, or just patients who continue to come in, that
Mhm.
the surgical interchange is a very valuable one where you plant the seed,
Mhm.
then more comes.
How about you? From your post-op recovery standpoint, how often are you giving it or how much?
So we'll typically do it for 3 days, and so we'll just do it. So if we finish, as soon as we finish the surgery, we'll put it on whatever area. So typically like a tummy, we'll just put the saran wrap on, put the garment on. We see everybody the next day. At the next day, take them down, recheck them, reapply it, put the saran wrap, put the garment back on, and then they'll take and do one at home. And so that's kind of our protocol for it.
So it's
We
every
do the same.
24 hours for 3 days. One of
Yep.
the keys also is that you can leave it there. You don't need to take it off. Because actually create more remactation as well. So even if it's not working as delivering the CO2 anymore, it's actually creating a little bit of remactation in the skin. So we left it, and it actually works better. We don't need to do anything else. Opposite. What did we use before? We used DMSO. And DMSO is very irritant to the skin. And you had to peel it off very quickly, because it started to be red, and it started like getting a little bit more irritation. Even if you use less than 70% and with aloe vera and everything, you start to see this kind of problems. Here is the opposite. The more time you leave it, the better. So it's easy.
It's good. Yeah.
Have you ever used it for post-rhinoplasty ecchymosis?
No.
I use it eyelids. I don't do rhinoplasty, and I couldn't convince my partner who to use it.
That's
Um,
very interesting.
but
If it works, it's like so.
yeah, yeah, it should be. I use it like post blepharoplasty and fat transfer in the perioral region, and it's.
Any difference between the eyes that you use it and the other side?
I mean, I can't say that I did a split, face with the eyes, but it's not messy. Did you try it? You gotta try
Actually,
it.
it's
So
like a gel,
look
and the
around.
gel
So
actually is a little bit like fluid, but later when it dries, it's just literally it just becomes like a silicone sheet, like a
yeah.
silicone patch. So it's very easy to bleed off. So it's massive.
How'd you come up with the thickness of the application? You kind of got a cream cheese on a bagel, or could it be butter on your toast, or?
Not really. You don't need to do a very thick. The idea is that it needs to cover the whole area. No, don't leave in any pores or any areas that you don't have the product in. As long as you have like a good layer, usually not as thin that you can see all the skin.
There
You
you go. You get
need
to
to
try
see a little bit the color of it. But that's about it. You don't need to have like a sandwich or anything. No.
it.
Yeah, yeah, yeah,
Yeah.
exactly.
It covers more area than you would
Yeah.
think from the vacuum.
Yeah, that's true.
Yeah, the packet. It'll cover your face and neck,
We are creating a body size too.
which will be great.
That was my idea.
Yes. It's coming out in the fourth quarter.
Because the thing is that the packages that you use for your entire body and for arms and legs are, you end up like taking like 4 or 5 packages, and it's a little bit cumbersome. So
Mhm.
if you can do a big area at once,
Great.
it's easy.
That's not harmful to fabrics and
Mhm.
staining.
No, not at all. No, doesn't leave any residue. There's a question over here. Yeah.
Okay, we're doing it right now the same as with a thermal study. So the thermal study also, gets a little bit more objectively about how is the vasodilation. So it's something that is in progress, but it's actually making very, very interesting results.
Like, you're talking small applications, you're using it in some bigger applications. Can you put too much on? Can you change the metabolic state of the patient by covering their whole body with it?
Well, that's a very good question. But the thing is, when you drink a Coca-Cola, or when you drink any liquid that has gas, you put more CO2 in your body than this. So you drink a liter, you drink, maybe twice as much as you're putting this on the skin. So it's not really like a toxic level of it. Maybe if you get into a pool of it, maybe, but I don't think so.
But even though they're doing the body one, like if you're trying to cover a whole tummy, like I'll cover a whole tummy with one packet stuff. So it's not like you're opening 3 or 4 packets to cover a tummy. You get a good amount.
Yeah, when I do breast surgery, it easily covers 2 breasts, a single packet.
We're going to be I want to thank you all, and we're not ending unless you want to. But one of the things we're doing is for everyone who's registered, you'll be able to get a sample of the CO2 lift. So if you make sure that on the registration they have your address where it'll be shipped, we'll make sure you get a sample for you to try it in your pocket for yourself personally.
Because you have a hyperbaric in chamber yourself. So
Yeah.
at what point, I think really interesting, at what point are you deciding, no, we're going to send this person to hyperbarics?
Well, actually, when we use flaps, the ideal for us is that all the patients go to hyperbaric. The thing is, when you have your own hyperbaric, you can see that rate of patients that cannot get in is almost half of the patients. They have ear problems, they are claustrophobic, they simply don't like it, they feel like they are too hot inside. I had to put an aircon in the area that had the hyperbaric because they said that they could not breathe because the temperature was too high. So at the end of the day, what happens with this is that it's something that you don't need the patient to go to a place, What we are doing nowadays, when they have, even with a flap at risk, okay, here you go, every 4 hours, 3 packets, see you tomorrow, And you do it at home. You teach them how to do it, and it's literally a consistent treatment. And if you use hyperbaric, even better. I use combined, so it's, when you have a flap that is completely blue, you do whatever there is,
Everything.
you put like holy water, rosary, pentoxifylline, whatever they say, garlic, whatever, So you end up doing a lot of stuff, and this is the kind of few things that you say, okay, this is working. The DMSO, for instance, I said works, but the back side was that, the irritation of the skin. And it was, in some patients it worked, and in some patients it didn't. And this one is a little bit more consistent, Thank you
Yeah.
very much,
Yeah.
guys. We had a
Thank
very
you all
interesting
for
meeting.
tuning in. We'll be here if you want to come ask a personal question, but give it a try for yourself. Minimum, glow yourself up for the next meeting after you travel.